just for a second, Norzad, all right? Okay, so we are live and we're going to talk about this question today, guys. What should we do in the 3 minutes? Just for a second, Norzad, all right? We start. Okay, so we are live and we're going to talk about this question today, guys. What should we do in the 3 minutes? Okay, start again. All right, so what should we do in the 3 minutes before we start? And I'm going to ask Salma to put her microphone on, if that's okay, Salma. Or if she's not available, we could try Assad. It would be great to hear from you, Assad, if you're available.
Good morning, Alan.
So Assad, you know about OET, you know a lot about OET. Tell us, what should we be doing in this 3 minutes before we start speaking?
First of all, I don't know a lot, a little bit. The second is my opinion. The first step should be reading the setting or the instructions.
Okay, so read cue card. Yeah,
read the cue card instructions. It's written there, setting.
The setting. So focusing on the setting. Okay, so I'll put this here. Okay, so and what else? So you're going. Oh,
so when we will pick up from here where we are and who is our patient and whether the person is known or unknown. So that.
Now, this is the key for me, guys. We need to focus. Is it known or unknown? Right, the person. Obviously, read the cue card, look at the setting. I agree, but this is probably the most important thing you just said there, Assad, right? Is the patient known or unknown? And I'm going to talk about that today because I think sometimes people get a bit confused about this. Okay, so we'll talk about, is the patient known or unknown? That's an excellent idea from Assad. Could I have Emal or Ezgi? Could you put your microphones on, guys?
Yes, please.
Emal, what else should we do? So we read the cue card, we think about, is it known or unknown? What else?
As Assad said, that first of all, we should know the setting. Is it hospital or clinic or home visit? Patient is known or unknown? And then review that the condition of the patient, what the patient has and what is the problem. And
just reading the cue cards, these are good points, right? But I don't think I need to teach anyone to read the cue card, right? So I'm not going to, for example, setting. Come on, everyone's going to read the setting. Of course they are, right? But they're not necessarily going to think about whether they know someone or don't know someone, right? Let's think about things that, okay, you read the cue card, definitely. Then you think, do I know this patient? Do I not know this patient? What else? Alina, could you put your microphone on? And Claudia, I want something that maybe is not so easy.
In my opinion, we have to check vocabulary.
Yes.
Because if you don't know it,
exactly.
You have to understand all the cue card. So vocabulary is an important thing.
And also, guys, did you know that you're allowed to ask them? Anything to do with vocabulary, you can ask, you can say, excuse me, how do I pronounce that word, please? And they must tell you. Okay, so if you're not sure about a word, you ask them, they will tell you. Also, you can ask them about meanings of words.
Yes, I did it in one mock test.
What does this word mean, please? They must tell you, guys. All right. So remember, ask questions. Okay, that's a great point. What about Akhtar? Could you put your microphone on, Akhtar? If he's not available, we could try someone else. Bianca, could you put your microphone on, Bianca?
Yeah, and you can also ask the interlocutor his name. If the patient is known, you can ask how you should call him.
Yeah, so think about known, unknown, and then give them a name. I'll put this here, give them a name. So your name is John, right? If known, before you start, guys, give them a name. Okay, establish that. Very, very important. Okay, Norzad, do you have any other ideas?
Yeah, I think it's always mentioned, but it's better to review all the cue card and also underline the points which you want to discuss with the patient, because sometimes the cue card is very long. For example, there is a lot of symptoms, and it is not possible to discuss each and every symptom. For example, the location, the duration, these things. You want, it's better to underline the points which is necessary and vital to discuss with the patient. This is also it's important.
When you say vital to discuss, though, we have to try to do everything on the cue card. It is all vital. You can't choose. You just go through sequentially.
Yeah, because the last week we had a discussion with Paul, for example, in the about the pain. There is a pain, for example, if you ask about the location of the pain, the radiation of the pain, the duration of the pain, for example, everything, if you discuss, and apart the pain, the patient has other symptoms as well. If you ask each and every one, I think it's not possible to finish the 5 minutes or 10 minutes. And the Paul said it's not necessary to mention all the symptoms.
It's not. That when they give you examples, usually in brackets, guys, I'll put this here. Examples in brackets, you don't need, it's not necessary, you don't need to do all of them.
Okay.
But again, I'm going to take this off because I take that point. I'll just put this here. All right. I'll talk about that later, in fact, Norzad. Why is no one talking about the most important thing we have to do? What's the criteria for this?
Yes, we have to make notes about the criteria.
Yeah, thank you. So who said that?
Me, Alina.
So which criteria is the most important? Is it the lexical criteria or the clinical criteria?
The clinical criteria.
For you guys, when you're planning, it has to be the clinical communication criteria. And what should we do how do we?
Relationship building.
Those are examples. Let's have some examples from all of you guys. So we have, how many are there?
5.
Yeah, okay. And what are they? Can you all shout out? What are they? Relationship
building.
What else?
Incorporating
IPP, incorporating the patient's perspective. What else?
Providing structure.
Information gathering.
Information gathering.
Information giving.
Right? So you need to look at that cue card and say, okay, so where am I doing these things? Right? If you're serious about OET speaking, if you think it's, if you've studied it seriously and you've learned the techniques from SET, you should be able to look at this card and say, okay, here I'm explaining something. That means I'm information giving. Okay, what am I going to say? How am I going to break it down? Right? So we need to be, guys, thinking about where the clinical communication criteria, or where we can do, right? Where we can do the communication. Is there anything else? There's other things we could, there's at least 5 things we should be doing here. So vocab, yes. Clinical communication criteria, yes. Is there anything else?
It's also important to listen to the interlocutor.
Okay, so that's when you start, I suppose. Yeah.
Yeah, and also when you do this criteria, because maybe you want to provide structure, but the interlocutor complaining, and you have to respond.
So we don't know if they're going to complain, though, right?
Yeah.
Is there any? I think there's another important thing we really need to think about, guys. Can anyone think of what else there is here?
I think understand the scenario and about the cue card. Is it about urgency, or is it about backing bad news or other clinical condition? I think we should focus on.
I mean, so many of you people have said this. I'm going to put it down then. So think about cue card. Fair enough. Totally agree. Card setting, and the scenario, etc. Okay. Is there anything else though?
Alan, can I add?
Yes. Asad, go on.
In my opinion, after that 2 points, known and unknown and vocabulary clarifications, then we have to come down and read the bullet points, and then we structure or imagine our conversation based on our clinical communication criteria. So
okay, I kind of like this. Imagine the conversation. I'm going to put this here.
or
Imagine
structure it, so how you structure, depending on the bullet points.
Yeah, now this is what I'm kind of waiting for someone to say. So I'm going to have to sort of tell you guys, which I guess is good because that means I'm teaching you something new. All right. One thing that we have to do is, yes, do all these things, but we have to think about, I call this active or passive. Let me put this here. Look at the bullet points and decide, are they active or passive bullet points? Okay, what do I mean by that?
You have, for example, this imperative verbs, just, for example, found, advise, explain, for example, or reassure. You know which technique you are able to use in this like task.
Techniques, yes, but what I mean is this. Dr. Saki, you were talking about this last week. Imagine it says explain the procedure, right? Am I going to do this, or will the patient ask me about that? Right?
You need to ask permission.
Ask permission? Well, it depends, guys. Look, can we see the patient's cue card? Answer, no. Right? So we have to think about whether a bullet point, I'm trying to think the best way to say this. Think about if you need to initiate or not. Does that make sense?
Yes.
So it might say explain the procedure. Do I have to do that or not, guys? In this case, explain the procedure.
Yes, of course, yes.
Well, we don't know here.
No, if they said explain the procedure, I should definitely start a conversation and explain the procedure.
They might ask you, can you explain the procedure? Or you might have to do it. You know what I mean? Change the subject.
Yeah.
So we need to think about that, guys. I call this passive tasks.
Alan,
go on.
What happens, here, explain the procedure when it is written there in the bracket, when asked, then it means you will respond to a question. If not written like this, explain the procedure like endoscopy, then we have to follow exactly the information providing procedure.
So, but Asad, you have to be very careful here. You don't know what the patient is going to do. The patient could say, excuse me, can you explain the procedure, please? Right?
When it is in bullet points, it means patient also has a cue card. It might not be in her or his cue card to ask such a question.
But I think we have to be careful.
If there is a question there in that cue card, it will be written there that when asked.
Not always, unfortunately. I wish it was so simple. You have to be able to. Sometimes it's not clear. All I am saying, though, Asad, is just think about it. Think about if you need to start that thing or not. Very often you won't know. You can just say, I don't know. But sometimes you can figure out, you can think, okay, this one is responding, okay? For example, let me give an example. What if it says, guys, reassure the patient? Is that, do I need to initiate reassurance or not?
No, because patient.
Why not? Why not? Because why would you reassure someone if they're not worried, right? So this one, we can probably say, okay, the patient's going to be worried, right? I don't need to initiate that. What does initiate mean, guys? Initiate.
It's the advantage of.
Or change the topic, like, okay, let's talk about, right? So I'm going to show you examples of this in a minute. But I think we now have an interesting list, okay? So we have, think about the cue card, okay? We have, think about the clinical communication criteria. Think about any vocabulary and ask them. We also have, think about known or unknown patients. Give them a name, as Bianca says, if they are known. Make sure you know what the name is before you start. Anything else? Anything else we can think about?
Yes, I think here it is.
Go on, Dr. Saki, please.
Yeah, it is important to write down maybe some sentences, and because this 3 minutes is a very a good time for us to think all about these things, even we can underline the key important word in the cue card, and as well as we can write down some sentences.
I think you're definitely right. And also, Dr. Saki, let's say this, because when I was thinking about this class beforehand, I was going to say, focus on verbs, right? And then think about what phrases do I know, okay? I'll explain what I mean by this, but Dr. Saki, that's what you're saying. Write down phrases you already know, yeah?
Yes.
There are always, and sorry, Nozad, you said key words, Nozad, sorry, okay? This is what you're talking about here, Nozad. I'm going to call these key verbs. Focus on, key, what do I mean, anyone? Key verbs. Key verbs?
Explain, reassure, ask.
Yeah, you can say that again.
Explain, reassure, ask.
Find out.
Right, I already...
Or we can say like action verbs.
Yeah, action verbs. We're going to see examples in a minute, Farhad. So, I mean, it's difficult for me to show you here, but later you'll see it. But action verbs is pretty much the best way to describe that, actually. Action verbs. So things like explain, reassure, find out. What else, guys? Explain.
Provide.
Provide. What else? Find out. What else do they say? Sometimes
advise.
Advise. Yeah, okay. So when you see those verbs, guys, you need to be thinking, as Dr. Saki says, what phrases do I know for reassurance, for example, right? If you see reassurance here, you should maybe write down some phrases that you remember for reassurance, right? If it says find out, what does that mean, find out? That means ask questions. So you can write down maybe some questions that you might ask. Plan what you're going to say. Okay. Sorry, Dr. Saki, did you want to add something here? I think you... Does anyone... For me, this is everything now. This is everything that we need to think about. Does anyone want to add anything to this?
Alan, just wanted to...
Farhad, go on, Farhad, please, yeah.
Yes, for instance, a cue card indicates that you have examined a child of a caregiver.
Yeah.
And then realize that she or he has this condition.
Mm-hmm.
Shall we start with, sort of relationship building, like introducing yourself, asking their names or somehow, or you just say that start from there?
Like starting in the middle, do you mean? Or?
In the middle, sort of.
Well, this would be introductions, I guess. Sometimes we can start in the middle, I guess, of the action. I'll put this here if you want, Farhad, right? Guys, ask yourself, am I starting in the middle of the conversation? Does anyone see examples of this?
I had it to my exam.
If you're starting in the middle of the conversation, do you need to introduce yourselves or not, guys?
No.
No. So you just begin immediately like, okay, so I've taken your blood test results. Here are your results, right? So I think probably lots of people don't realize this and they forget to check this. Okay, starting in the, I'm not sure if that's exactly what you were talking about there, Farhad, but it's definitely an important one that I...
Yeah, because Alan, during one of the role plays, when I started as in the middle of the conversation, one of our classmates' comment was that you have to start from relationship building, otherwise you will not be involved.
Yeah. Okay, so thank you for that, Farhad. Guys, look, we know there are examples, official OET materials, where you will not introduce yourself because you're starting already in the middle of the conversation. Okay, now what I want to do now is let's try and take all of these things. I know it seems like a lot, but we're going to try now to apply this to a nurse's card and to a doctor's card. What does apply mean, guys?
Can I mention one thing?
Implement.
One second. We're going to try to apply this to do it, right?
Implement
all of these.
Practical settings.
So let's try and remember, guys. Vocab, okay? initiate it or not, known, unknown, focusing on key verbs. Okay, all of this stuff. Take a photograph if you're not sure. Okay. Now, Abdullah, I'll take some questions at the end, but I'm just going to sort of move on to the next part of this class now. Here is the first cue card that I wanted you guys to look at. Can everyone see this here?
Yes.
Okay, so is this doctor or nurse?
Doctor.
Okay, let's see if we remember the things now. So we're going to analyze this card, right? Do we remember what were we saying before? There's at least the 6 things now. What do we have to do?
It's a location. Very good.
Vocabulary, for example, right? Do you remember? What did we just say we need to do, guys? Vocabulary, what else?
Patient is known or unknown.
Known or unknown. What else?
Settings. Clinical criteria.
Setting clinical scenario.
Criteria. Read the card and think about settings.
Communication criteria.
Settings, structure. What else, guys? There was 6
Action verbs.
Action verbs, and write down what?
Focus on keywords.
Anything else? One more.
Focus on keywords.
Shall we add one thing there? Identifying the points where we have to double check with the patient, like patient understanding.
Yeah, well, that would be clinical communication criteria. Yeah, that would be information giving. Yeah. So we're going to do that now. The last thing is, guys, initiating. Right? Remember, I was saying initiating. Who does it? Me or
patient?
Patient. Okay. So those are all of the things that we just discussed. Now I'm going to stop talking and I'm going to give you guys 2 minutes to read and think about this card. Think about vocabulary. Is there anything that we don't know? Think about, do we know the patient or not? Try to think about clinical communication criteria, right? Where should I do relationship building, for example? Read the card, think about the setting and the general structure. Think about action verbs and think about who is going to initiate this, okay? Please no talking now, let's just wait for 2 minutes. 3, 2, 1, start now. All right, so I'd like to just ask a few people to help me with this, and then we can take questions, but I just want to ask for, I'm going to choose someone randomly, maybe Maria or Jenny. Could you say hello? Or
Hello.
Mike?
Hello.
Fantastic. Who do we have there? Who's that?
Maria.
Maria. Okay, so
Jenny.
she went first. So Maria and Jenny. So is there any vocabulary here that you don't know how to pronounce?
I'm not sure about tetanus.
Ah, where's that one, guys? Tetanus.
Tetanus. Okay.
Right? So you can say, excuse me, how do I say this? Maybe this one. How do we say this one? Ruzgar. Pronunciation.
Allergic.
Yeah, that's okay. So we need to think about these things. Allergic, tetanus. Anything else strange here? Are we okay with this one, guys? Probably very easy.
Triage.
Triage.
Oh.
Okay.
Is it triage or triage?
Triage. Yeah, 100%. Okay, hand guard. I don't even know this one.
Vascularization.
Vascularization.
Okay, so that's the vocab. Okay, known or unknown? Everyone, is this patient known or unknown?
Unknown.
It's an unknown patient. How do we know that? How do you know? You can see the situation. I'm going to talk more about this tomorrow because sometimes this can be a bit tricky, known or unknown, okay? For example, let me just make a quick point about this. Your patient, okay? Does that mean known or unknown? If I see that.
This could be known as well, Alan, this one.
It's emergency department.
Just forget that for a minute, guys. If you see the words "your patient," does that mean known or unknown?
Known.
I think known.
Known.
Well, this is the thing, you see. This is the thing, because it can be plural or singular, right? You know, in English, the you as well is plural or singular. So this could be your facilities patient, right? So it's not. Go on, Bianca. Go on.
It's like the patient who you are dealing with is not known. Is any patient can be.
It's not necessary that you know that patient with your, right? Because this can be one, meaning the doctor, or it can be many. It can be singular or plural. We'll talk more about that tomorrow. Okay.
Also, Alan, and if it is the GP surgery sitting, that patient could be registered with the GP surgery, but you might be a new doctor. You might not know him.
Exactly. So very often students, they see your and they think, oh, that must be singular, like my, right? But your can be your GP's patient, right? We'll talk about that tomorrow because we need more time to discuss, okay? Clinical communication criteria. Now, come on, guys. Where is my relationship building here? Where am I building relationship?
Critical patient.
Here, right? And here, right? So there's my relationship building, right? Nice, appropriate introduction, and then lots of empathy. Oh, I'm sorry to hear that. That must be very difficult for you, right? And reassurance as well. What's a phrase for reassurance? What do we say?
Let me assure you.
Yeah, exactly.
We are on the safe hand.
All that stuff. Yeah, exactly. What else? What about information giving? Abdullah, is there anywhere here that I'm going to have to explain something very substantial or big? Maybe.
Yeah, when it says
Explain the hand wounds carry a high risk.
So information giving. What do we have to do for information giving, guys? What's important?
Let me explain. Let me give you information about.
Check for knowledge.
Check, right? Is that clear? So here I'm going to be checking understanding. Okay. Do you see what I mean, guys?
Check for initial knowledge.
Asad, go on. Yeah, there's
knowledge.
many things, right? So what do you know about? And then you explain, then you check understanding. Definitely I can do this here, okay? What about anything else I could do here? What about antibiotics here? Importance of antibiotics.
Stresses, emphasizing
the importance of.
Do you know the importance of taking antibiotics?
Well, I'm thinking providing structure here, right? You could say, okay, let's talk about antibiotics. What do you know about the importance of taking antibiotics, right? You're changing topic change. Probably this is a topic change, right? Okay, moving on to my next list. Okay, so what about, so obviously reading the cue card, settings and structure, we read this, we pay attention to this. What about action verbs? Farhad, you were saying action verbs, where are they?
Like, for instance, suggest is an action verb. Almost everything is an action verb here.
They're usually at the start, aren't they? But also can be sentence 2 as well, right? Agree? Where are the action verbs here, guys? Explain. There you go, right? So as Dr. Saki says, now I need to think about what phrases do I know, right? For example, suggest. Farhad, if you could come back, suggest. What's a good phrase for suggesting something?
So
recommend.
I could say
Just Farhad, guys. I recommend. Someone said I recommend. What would you say, Farhad? To
Yes,
suggest.
I would recommend you to take.
I would recommend
you ibuprofen for.
Yeah, I recommend that. I suggest that. Right. You don't want to say you should, though, right?
Yeah, sure.
You should is a little bit too strong in English.
It would be a good idea.
Yeah, it would be a good idea for you to. I recommend you to. Okay. So, guys, here we're looking at action verbs and we're trying to write down phrases that we know. Okay. Last one. This is where it gets a bit tricky. Who is initiating these? For example, well, this one here, reassure the patient. Who's doing that one?
GP.
Doctor.
Doctor.
Right? Well, the first one, Nozad, you're right. The first one will be the doctor.
Doctor.
What about explain? Do we know that is, will I do that or will the patient ask me? We don't know, right?
We don't know. It depends on the situation.
Antibiotics. Who do you think is going to do that one?
It's the doctor.
I think that's the doctor because the doctor knows about the importance, right? Why would the patient ask me, is there anything important you want to tell me? They're not going to say that, right? So this is probably the doctor. What about suggest ibuprofen?
Yeah,
the doctor.
Why would you suddenly talk about pain relief at the end?
No, it's the patient. He's asking.
I think this probably, we don't know, but probably patient is going to ask, right? If you get sudden changes in topic, you need to ask yourself, is that because the patient is going to change topic or am I changing the topic?
In this scenario, I think the doctor should do that because the patient is allergic to paracetamol. So that's the doctor to address this point. It is very important.
How do we move from antibiotics to ibuprofen? I mean, maybe you're right, sir. Maybe you're right.
In the context, you can see the patient was allergic to paracetamol. So there should be alternative.
Okay, but is it not possible that the patient might ask?
Why not?
It's
possible.
We're not sure though, right?
Alan, I have a question.
Not sure. Question, go on.
Yeah. What you will suggest, how respond, for example, agree to her friend being present during the procedure?
Sorry, say that again. Your connection is not great. Sorry.
Okay. How would you suggest us to respond for this? Agree to her friends being present during the procedure.
Agree to very, very good. Now, look. Let's have a look at this because you know what? Let's have a look at this, guys. First thing is the patient going to ask this one or am I going to do this one?
The patient asks.
We know the patient's going to ask. And is this going to be this is going to be maybe a difficult thing to answer, right? So maybe I'm going to talk more about this tomorrow, but maybe one thing we need to do, guys, really is look for things like this. What is that in a cue card?
I think here we know that it is, since it is like imperative agree, it means we have to agree. We know that we have to agree with the patient is suggesting that relative.
I agree, but I think that the point here is, look for difficulties when you're reading that cue card. I'm going to change this here. Look for that part of the cue card where you think, oh, how am I going to respond to that? Right?
I think sorry, Alan. I think if you ask, do you have any question, then the patient will tell you. So you will have to I don't know.
But I think the doctor should follow the protocols.
Yeah, well, look, I'm going to talk about it tomorrow, but remember the class today is not, we're not going to be doing any speaking today. We're just talking about how to think, right? So I will add, I'm going to change number 4 to look for difficulties like that, because it's not clear what you should do. And we will talk about what you should do tomorrow, okay? And tomorrow I'm going to put you guys in groups and you're going to analyze cue cards and we'll talk about it. But in general, I think these 6 things are probably the best. You know, I've been teaching OET for a long time, right? So I had 5 things and you guys gave me one more today. I really think these are the good things, okay? We'll talk more about it tomorrow, but I have to finish, all right? Thanks very much for attending this class. Tomorrow we will continue with the same topic, all right? Analyzing the cue card, but I'll put you in groups and you guys can practice as well. Thanks very much, everyone, for watching.
Thank you so much.
Say goodbye.
Thanks, Mr. Alan.
Thank you.
Bye, everyone. Take care. Have a great day.
Bye.
Bye-bye.